Hey everybody, Dennis with Respiratory Sensei here. Okay, so you're in the ER and somebody comes in with COPD and their CO2 is 90. The question you have is, what are they normally when they're not sick? So where do they normally live? Today we're going to answer that question, so come with me. All right, so for you respiratory therapists and nurses out there, the key question that you have when you have a COPD patient, you know their carbon dioxide level in the blood gas is going to be elevated. That's why they're COPD. But the question you might have is, where are they living normally? You don't know what to make a CO2 of 70, 80, 90. Maybe 90 is not so bad if they normally live at 80. So today I want to show you just how to look at a blood gas very quickly and calculate what they normally live at. So we're talking about COPD, and we're going to talk about their CO2 and how to predict their baseline CO2 value. So let's just do that. Okay, so the first thing we have is that we know that we have pH and CO2. And what we know is this. We know that when pH goes up or down, but when it goes up, the CO2 is going to go the opposite direction. All right, so we all know that. But here's something that people commonly do not know, and that is that when pH goes up by a certain amount, CO2 also responds by a fixed amount. And so here's what we're going to say. If pH goes up by 10, now I'm going to say 0.10. Keep in mind that normal pH is about 7.40. Then if this goes up by 10, no, really it's 0.10, then CO2 is going to go down by about the same amount, except it's going to go down by 10. Remember, normal CO2 is about 40. And so because of that, we can take somebody's pH and figure out what their CO2 normally is whenever they're not sick. Of course, COPD patients always have an elevated CO2. The question is, where do they normally live at? Okay, so let's continue. Okay, so let's just use our newfound knowledge and do some calculations. That's probably the best way to do this. So the first thing we want to look at is we have a COPD patient here, and you'll notice that their CO2 is 90 and their pH is 20. Now the trick here is that I'm going to correct the pH in my mind or on paper, and then I'm going to use that data to figure out what they normally live on their CO2. And so here's what we're going to do. The first step is just correct the pH on paper. We'll check this out. All right, so if we have a pH that lists here of 7.20, we're going to take that right here. We're going to say 7.20 and ask, what do you have to do to 7.20 to get back to 7.40? Okay, so 7 plus what is going to equal 7.40? And the answer is 0.2. Or you might just say 0.20. I like to see the 20 in that mark. Well, if I've added 0.2 or 20 to the pH to get it to normalize, then that's what I have to do, except opposite to the CO2. So right now their CO2 is 90, and so I'm going to take a CO2 of 90. Instead of adding the pH of 0.20, I'm going to take away that 20, and I'm going to get 70. In other words, when this patient is normal, for them anyway, then their normal CO2 is 70, okay? And so we know where they live. They live at 70. Sometimes a doctor will want to look at previous ABGs to try to figure out where they are or where their baseline is. But you can step up as a respiratory therapist or a nurse and just do some quick math and say, well, I don't need another blood gas. I can just tell you where they live just by looking at one blood gas. Hey, just for fun though, let's just do another one. Okay, so in this case, we have our second patient, and they have a CO2 of 75 and a pH of 7.25. And so its pH is 7.25. All right, and so let's go check that out. All right, so the question is what? Take a look at our pH. So we have 7.25 plus what? And sometimes it's a minus. Plus what equals 7.40. And of course, if you look at that, can you tell that you have to add 15 or 0.15 to that in order to get 7.40? And so can you see the 0.15 right here? Well, that's the same 15 that if we add it to get the pH to where it's supposed to be, all we have to do is do the opposite. We're going to subtract that same 15 from the CO2 to figure out where they normally live. Now, in this case, their CO2 is 75, but we're going to subtract the 15, and then that's going to equal 60. So this COPD patient who might be in an ER, they definitely have an acute-on-chronic problem. Maybe they have pneumonia. Their pH is definitely decreased and they're getting acidotic. In fact, this is ventilatory failure. We might have to put them on a ventilator. But the question is, where do they normally live? And the answer is 60. And so they normally live at 60. Let's just do one more patient that looks a little bit drastic. Okay, all right, now check this patient. Now, we have a CO2 that's 100, and that probably freaks people out. I've definitely been in the ER before where I've got called stat because there's a COPD patient with 100. And you walk in there and you do a little bit of math and you say, yeah, they're 100, but it's not that big a deal for them. And so a nurse might think that they're about to die because of that, because they were taught that pH is supposed to be 40, and they rarely ever see a CO2 of 100. But this is really about how much you freak out about the CO2 that you see. In order to understand that, you have to figure out, well, where are they normally living anyway? All right, so we have a CO2 of 100, but a pH of 7.30. Now, isn't that interesting? It's not quite corrected, not quite compensated, but it's not very far off, is it? But let's just do the math and see where they normally live. All right, and so we have a pH of 7.30, and the question is, what would we have to add to that? What to equal 7.40? And the answer is 0.10. Can you see the 10? That's where we're concentrating. We're concentrating on seeing, if you want just to point this out more clearly, we're looking at the 10 and the plus sign, because if we have plus 10 there to get to normal pH, then what we're going to need to do is decrease or take away 10 to the CO2 to figure out where they normally live. And so let's do that. Okay, and so back to our board here. If we have a CO2 of 100, the question is, we're going to take away, remember, not add, but we're going to take away 10, and what we're going to get is a CO2 of 90. What we're saying here is that COPD patient normally lives at 90. All right, that's a very interesting thing to do, and you can do it not just with COPD patients, but you can do it everywhere. There's always that relationship between the CO2 and the pH. By the way, we'll cover this in another video, but that relationship is called the respiratory relationship. And as long as that relationship is true, then whatever problem there is going to be called a respiratory problem. But just to give you a hint, if you look at that relationship and it's not true, then it's going to be a metabolic problem. But in this case, we're just looking at the respiratory relationship to calculate what the COPD patient normally lives at in their CO2, even when it's high. All right, hope that was helpful. This is Dennis with Respiratory Sensei. Listen, we have more videos coming out. Just be sure to subscribe and hit that notify button. And please leave me a comment, like it, tell me if we're on the right direction. All right, talk to you later.